Okay. I also promised this video in English, so I'm gonna try to make it in English. Hopefully, it's gonna be shorter than the one in Spanish. But so my friends in English, my English speaking friends also they understand the importance of how to speak your mind about your medical rights as a woman, your female medical rights and issues that you may have, and also that so you know that you're not alone, that there are real people like me. You know, I'm a nobody. But I feel like it's important to share it with people because I've actually shared it with friends, and all my friends they say, "Oh my God, I am so impacted," and it's such an eye-opening experience, and all of them they get super surprised. I don't get super surprised because although I was shocked, but I don't get super surprised because I've been going through it. But all of them they share stories with me, and they're like, "Oh my God, that's so amazing that you went through that." So I think everybody should maybe it's interesting for you to share that. This happened last week. I had a laparoscopy, which is a type of surgery. And this week I've been like I'm recovering now, and this week I've been so tired. And yesterday or 2 days ago, my treatment with painkillers was over, so now I'm feeling all the feels. And now I think I have like some type of like bronchitis or something. I don't know what it is. I'm coughing so much, so I feel the pain in my uterus. I feel the pain in my in my lungs. I feel the pain in my throat. So I have a cup of tea. If you see me sipping in between, it's because I don't want to cough too much. And I don't want this video to be long. Anyway, so what I wanted to say was, so you know how I got into this laparoscopy back in 2015. I had a menstrual cramp. It was like the mothers of menstrual cramps to me. I when I had it, I didn't recognize what was going on with me. I It was a pain that it felt like in my Spanish speaking video. I describe it as, you know, the in Alien, when the alien is getting out of the stomach of this woman. That's the exact visual representation of this pain. It also felt like they were taking my two legs and they were ripping them apart from my pelvis. It was a pain I didn't recognize. Of course, I was scared. Back in 2015, I was like, I was what? I was 27 years old, and I was like, oh my God. I mean, not super young, but also not old at all. Actually, I was young. Um, so I don't know what was going on. I was in the middle of a class for a certification that I was going through with my job in that at that moment, and they paid for my certification. So they took me to a resort, and in the resort we're having the lessons. And also we were sleeping in that beautiful resort. It was in Montañita, Ecuador. It was by the beach. So as beautiful as the place was, there was no hospital center, and that was the first time that I got a menstrual cramp so bad that I actually passed out. It was, you can imagine the level of pain. And by that time, by age 27, I already went through other physical pains that they were bad, that I don't want to uh, remember now because they are really bad. Actually, getting it, I have like some PTSD, but they were bad. Like I knew what pain was, so and I knew how to deal with pain. I'm talking about physical pain. So when I got this pain that I couldn't handle and I passed out, when I woke up, I was like, oh my God, what was going on? I remember, like, because the thing is that the thing with this pain, and a little maybe whoever is listening to me can relate. You know, this type of pain that is bad already when it's starting, but it just keeps upping up the notch, and it doesn't stop. And you're like, okay, you know what? I think I can handle now. And then it just gets worse, and I think I can handle now. I was going through that, but every 5 minutes the pain was growing bad. So when I stood up and left to my cabin, to my hut, to rest, because I started not feeling my legs. That was the moment that I was like, I need to stand up and get the fuck out, because I cannot. I cannot start screaming out of pain. It got to the point that I was like, I will start screaming. So I stood up, left, went to my hut to deal with my situation by myself. And the person who was teaching that particular lesson in the certification, she actually it was that was so rude, and she was like a very important person teaching at that moment. So of course she actually left the lesson to see what was going on with me, but she went in like she was ready to be like, who do you think you are? You can stand up and leave in the middle of my lesson. But when she saw me, I don't know. I think it was like The Exorcist. I think like it got to the point that I think if she had come 30 minutes after, probably I would have crawled like The Exorcist on the walls. It was like it was supernatural. It was something I've never I had never felt until then, because I had actually several episodes after that. And I was like in my bed, like, I was like with the blankets and like throw myself on the floor and then getting back in the mattress and like trying to contain myself and trying to understand. And when she saw that, she was like, "Oh my God, let's take her to like a medical center. What's going on?" So she took me in a medical center, and we got there by a taxi. And when I went inside the taxis in Ecuador, some of them, they have like a handle. The pain was so intense that I ripped off the handle. I tried to gather myself by hanging on this handle, and I ripped it off. So the taxi driver was screaming, everyone was screaming, I was screaming. When we got into this medical center, now again, remember, we are in like a sort of back in those days, wasn't remote. It wasn't remote, but you don't have the best medical facilities in there. So we got into like a humble medical facility, and when they saw me, the first thing they asked me was, "Are you having an abortion?" That was the first thing before I actually passed out. That's the last thing that I remember before I passed out. And I remember back in the days, once actually my mom, she had several abortions, and I remember that my mom told me that actually having an abortion, it's way more painful than giving birth. Like that pain, it's uncanny. I remember my mom saying that like in the past. So when they asked me that question, I was like, oh, shit, this is bad. In like my pain crisis, I was like, oh my, what is going on with me? Then I passed out. Then I woke up, and immediately I asked what was going on. So they put me on IV and stuff, and they told me, you know what? We don't know what happened. We don't know what happened. You passed out. You are not pregnant. You are not going through an abortion. We don't know what happened. The only thing is that you have your period, and that's it. And I think that's the moment that I normalized the things that came after, because I saw that the pain was so big that I passed out. I mean, do you understand that? I passed out, and when I woke up, they were like, "We don't know. Just go ahead and live your life." So I saw, okay, you know what? These doctors, they are telling me to continue with my life. They are not alarmed. I woke up. I can't walk now. I guess nothing's happening. So I went on and lived my life. This was back in Ecuador, 2015. Fast forward 3 years, 2018. I'm in Vietnam. But you need to know that after that episode, I actually went to several gynecologists in Ecuador, and I asking for questions, and all of them, they were like, let's have like a screening. And they saw my uterus, and I think, oh my God, I should know these words for this, but I don't know if it's like a sonogram. I don't know. I mean, they screened it, and they couldn't see anything. Nothing, that it was like nothing. I think one gynecologist saw that I had like lots of like follicles in one of my ovaries, and she was like, it looks like it's PCOS, but I mean it's actually very normal what I'm seeing. And I think she put me like on a pill for like 3 months, and that was that was the extension of like answers that I got from that particular episode. And since it never happened within 3 years, I was like, oh, actually maybe this is normal, because I also didn't have these conversations with many people. I didn't share with my family much. I've never shared with my family that I passed out in the moment. Anyway, fast forward 2018, I am in Vietnam getting dressed to go out with my friends, and I get this pain again, and I panic because I was like, oh my god, I think this is like, I know how it's gonna go. I know that I'm gonna pass out because it started feeling really similar to what was happening, and I did. I passed out. I was I crawl into the bed, and I think I was trying to like have like a child's pose or something. I was trying to make myself comfortable, and I passed out in the position of child's pose. Like I passed out like this. When I woke up, half of my body was out of the bed. Like half of my body was in the mattress, and half of the body was like hanging. And I was like, oh my god, what's going on? What's going on? And when I woke up, still the pain was there, but it was like sort of like quieting down. I don't recall any time space. I think it was like hours. I don't recall what's going on. I don't know how long I passed out. It looked so dangerous. And then I went, because I was my period, I went into the bathroom and I checked myself. And I remember I actually, when I was checking myself, I got like I in when I was explaining this in Spanish, I explained like I was like, it was like a little ball. It was like a ball like this of silicone, you know. It was not un coágulo. No, because blood clots. It was not a clot, because blood clots, when you do this, they disappear. This didn't disappear. This was hard. This was from. This was hard but elastic. You know what I mean? So and I remember I watched it and I inspected it, and this was back in 2018. Like I was not, I didn't jump immediately in the internet and Google for it. I should have done, but I didn't do it. I was just trying to ask for explanations and trying to see like if there was something like it was so clear and it was so white that because I didn't see like any spots or anything, like any blood clots in it, I was like, maybe this is just normal. It doesn't look dangerous, and I actually threw it away after like 30 minutes or something of inspecting it, which is really stupid. It's really stupid that in that moment I normalized that thing that I still don't know what it was came out of me after having a cramp, where I passed out, and I just moved on. Called my friend. I was like, I'm so sorry, I passed out from like a menstrual cramp. She was like, the fuck, and kept living my life just like that. It's now that I say it's crazy, but anyway. And then after that, I remember I started going to gynecologists in Vietnam, trying to ask for explanations what was going on, and they were like, qué raro. Like, I don't know what that could have been. We just don't know. This was the nonchalant attitude that I got from every single gynecologist that I have told this story to. Uh, every single gynecologist has been like, I don't know. I don't know what to tell you. Weird. Weird. Anyway, so after that, the third episode was in 2020. And in 2020, I was prepared. In 2020, I already knew what ibuprofen 600 milligrams could do to you. So I think I had like a box of ibuprofen, and when this pain happened in 2020, I was like, oh hell no, I'm not gonna pass out. I will fight this. I will fight this with. If I have to take the entire box, I would. Sorry. So I took 3 of them. I remember, maybe 4, and I. It sort of minimized. Let's not call it minimized because it didn't. But it made the level of pain that, like, low enough for me to not pass out. But I can tell you, those were one of the. It was hell. And it was like 4 hours of hell, of feeling my um, legs being ripped apart, of feeling like the worst physical feelings that you could feel. I felt them in that space of 4 hours, feeling like there was a bunch of nails in my uterus while my legs were ripping apart, and this little alien was trying to get out of my belly button, and sweating and trying to, and like my uterus on fire and like contracting, and my hips were like trying to like get out of my body while my back was in all that for 4 hours. So by 2017, when it happened to me in Vietnam, I downloaded Flow, which is like an app to track your menstrual cycles, and I started like observing myself, because the second time that this happened to me in Vietnam, I was like, you know what? And gynecologists are not giving me answers. Let me just try to observe myself to see. And between 2018 and 2020, I observed that I had a lingering pain that came and went, a lingering pain, and it was always during my ovulation. Ovulation could happen between, like, in the space of 5 days, but there is one particular day in the middle that it's like it's the day that you are actually ovulating. Like during these 5 days, I had like a lingering pain around my left ovary. It was like around there. Um, and I actually, when because I was inspecting myself, I found the actual spot where if I would press hard enough, that's where it was. That was the source of the pain. I was like, I found you. So when I found it, I went to several doctors in Ecuador, in Vietnam, and now in Germany in 2020, saying like, what is here? What is here? If it's not my left ovary, where is it? It's it like, and then doctors, they speculated like it could be like maybe it's a muscle because your body is misaligned, or maybe it's the colon, or maybe So I try to see like, okay, if it's the colon, then take me to like a gastroenterologist. But in Ecuador that's impossible. In Ecuador, your intestines, like, they should be out for you to go to a gastroenterologist. The way that medical system is designed, it's like they will, and if you can ask to your general doctor to give you a medical appointment with the gastroenterologist, but it will take you like a year. It's crazy. So through Ecuador, it was difficult. In Vietnam, I think I never asked for a gastroenterologist in Vietnam, or maybe I did, but they didn't find anything. And in Germany, it was a mix of Ecuador and Vietnam. They were not that like ineffective, but also they were not that flexible or lax. So many doctors, they have like many theories, but the follow up or the instigation or the research, like the planning of the next steps, was never like solid enough. Sometimes because I was not in the same place at the same time, or sometimes because I asked several times to them, and they were like, I don't think it's necessary that you see another person. I got discredited by many, many, many doctors. I want to say like maybe 10 or more. For sure, a number between 10 and, for sure a number between 20 and 10 and 20. I got discarded. I got discredited by many doctors telling me that everything was in my head, that I was a hypochondriac, that and I normalized that. I said like, what, maybe it's in my head, and yeah, and I left every single medical facility thinking that it was in my head. So in 2020, I already knew that I was irregular, and I had this pain, this lingering pain around ovulation, blah blah blah. So when this happened again to me, I understood that it's for 4 to 5 hours that the pain gets really intense. Sometimes the whole day. Why? Because after 2020, they started getting more often, and I was like, oh wow, this is getting like, I don't think this is getting better. I think this is getting like, I mean, now I started having like in 2024, I had 3 of those. And I think after the one in 2020, then I got another one in 2021, and then 2 more in 2022, and then 3 more in 2023, and I was like, okay, this is not getting good. So this year, 2025, I went to another gynecologist. I have my annual general checkup all the time, and I've been living in Germany since 2021. So in 2025, when I went to my general checkup, I actually talked to my amazing family doctor, and I was like, you know what? I know that I'm healthy. I eat healthy, and I exercise and stuff like that. But I have this pain that people keep saying that it's in my head, and I don't think it's in my head, and I think it's actually getting worse. I'm having these crazy pains more often. I have to take sick leave more often now because of this, and I just need an answer. I need something. I need something. I need somebody telling me I believe you. So she actually listened to me and she was like, you know what, let's schedule a colonoscopy with our gastroenterologist. Colonoscopies are not for people your age. They are for people like in their 50s or the youngest 45 plus. But um, let's see, maybe it's something in your colon and we don't know, because by that point I already went to the physiotherapist to inspect if it was my psoas, if it was my because I also observed that during these 5 days I had this lingering pain, but the day of my ovulation the pain went from a scale from 1 to 5, it went from 1 to 2.53 out of 5. And it projected to my chest. So actually, for me, that was indicator today is my day of ovulation. I saw it, and my tracker, because I've had it for years now. My tracker is very good at even though I'm irregular, my tracker is very good at knowing when I'm going to ovulate, and knowing when my ovulation days, and knowing when I'm gonna get my period. Like my tracker, I am irregular, but my tracker knows the day that they say you're getting your period, I get my period, and it's gonna end here. It's gonna end here. I don't know how they do it, magic, but yeah. So I trust that my tracker. I trust my tracker because the day that they always put in circle that this is your ovulation, that day I had the shooting pain to my chest. So, and I started going to the doctors and saying like, what is this shooting pain? Like, you cannot sit down there for 10 years and tell me that this is normal. A shooting pain that comes and goes to the chest. Like, could it be a cancer? Could it be something? And it has to be with ovulation. It has to be like a menstrual cycle or something. So when she told me, let's see if it's your colon, because your colon is also in there, in that area that you touch. I went to the gastroenterologist. The gastroenterologist put me in anesthesia, went to my colon. I woke up and he told me, your colon looks beautiful. It's fine. There's nothing there. I actually think it's endometriosis. By that time, this was this year. By that time, I already thought myself that it was endometriosis as well, because I started hearing women with endometriosis, and the way they were describing the pain sound very similar to what I was going through. But also they had lots of other things that I didn't have. So in my world, in my head, I was like, well, I don't crawl on the floor for 3 days, or I don't medicate myself to the point that I don't feel anything. So couldn't maybe we don't have the same thing, you know what I mean? So I was normalizing, because I had friends with endometriosis in stage 4, like what they have gone through. Like, I have friends. You know who you are. I'm sending you kisses if you're listening to me. And the medical procedures that they have had gone through because of the pain, and I've seen the pain. Like that pain that I've seen from them, it is uncanny. And I'm telling you that I had a pain that I passed out. I cannot imagine what they went through. So because it was not that bad in my world, I was like, okay, maybe I don't have what they have. So that gastroenterologist told me, just find a gynecologist and to see if your gynecologist can help you with stuff. By that point, I already had like 2 gynecologists in Germany. 2 gynecologists that they thought I was crazy. I was always saying, please check the left ovary. Every time that they go through with this, they go through your vagina with this thing, and you see it in like a screen. I would always tell them, please go to the left. Yes, there, right there. What is it? You're touching it. Tell me, you should see something. And they were like, there is nothing. Your leftover is fine. Your leftover is a little bit hidden behind your uterus, but it's fine. It's normal. There is nothing. You're crazy. It's in your head, blah blah. Yeah. So the gynecologists that I had, they were sick of me. They didn't want to do anything with me. Every time that I would go and get my pap smear, they would avoid eye contact. They would not even talk to me, not even small talk, because they knew what I was going to ask, and they would be like doing their thing and leave. So I went to another gynecologist, and this was one day before I flew to Nairobi. This was this September. Whew. So I went to this gynecologist one day before I flew, and I was like, listen, I came to you because I have something that nobody has been able to find the answer. And I'm telling you right now, everybody looks in my uterus, everybody does this procedure that I don't know the name of. I've had hundreds of those procedures in these 10 years. And everybody says that everything is normal and fine, but I know in my heart, I know in my body that it's not fine. I have these pains, and now these crazy menstrual pains, I'm having them more often. I need answers, please. So he observed me, and he was like, okay, let's see. He did again, went in, checked the screening and everything. He was like, I don't see anything bad. I actually think it's fine. I think it's fine. I only see, and this is important what I'm going to tell you, I only see a little bit of liquid here, and several gynecologists have seen it. I see a little bit of liquid here, but I mean, it's not that much. So, and I was like, but what is this liquid? Is it supposed to be there? And he was like, I don't know. I don't, it's not that much. You shouldn't be concerned. Maybe we can see if it's chlamydia. Can you imagine? If it's chlamydia, that would explain that. We can get you tested on chlamydia. And if it's chlamydia, then that's it. That's the answer to that pool. But if it's not chlamydia, I don't know what to tell you. It was never chlamydia, because they ran the test. And he said, I don't see anything. I don't know what to tell you. I don't know what you want me to tell you. Or what we could do. But 10 years, he said, 10 years is too long. 10 years is too long. What we could do is a laparoscopy. First time that a doctor uses that term in these 10 years. What we could do is a laparoscopy to see what was happening. And I'll never forget, he said, but I am convinced that you don't have endometriosis. This doesn't look like endometriosis. You do have a myoma, which is 3 centimeters. And to me, 3 centimeters sounds big, because I don't think my uterus is that big. But he said it in a way that it was like, it's not that big. And it's not inside the uterus. When the myomas, he told me, when the myomas are inside the uterus, they are dangerous. But when they are outside the uterus, they're not. And your myoma, it's actually it's a ball that it's sitting on top of your uterus. So I don't think it should be removed. But besides that, I don't know. Let's see what the laparoscopy reveals. So I went and tried to schedule my laparoscopy. I thought that it was going to be as easy as the colonoscopy. The colonoscopy was going to be like a day. My colonoscopy was a day, and there was like 3-4 days of preparation, and that was it. I was able to walk that same day. So I was like, maybe the laparoscopy is the same, because every doctor kept saying that it was very quickly. But then when the nurse explained to me, the one who was trying to register me in the laparoscopy, she explained to me, no, like, I mean, yes, it's not too invasive, but you will need 6 weeks of resting. This plane that you want to take to Nairobi, that's not gonna happen after. I mean, it will happen after 6 weeks of you recovering in Germany. And I already left my apartment in Germany, etc. I was about to fly. So I was like, you know what? No, please. No, I'm just going to try to get in Nairobi. I went to Nairobi with my German papers, and I went to, I asked for very good gynecologists, and they gave me a couple of names, but there was a particular name that I actually researched on, and I found his medical website. Well, actually, I found the hospital that he works on, and the hospital that he works on has everybody's credentials on there. So I saw like the 2 names that everybody was mentioning, they were actually in this website. But one of them, the gynecologist I went with, one of them, he was a specialist in laparoscopy. He is actually an assistant professor in laparoscopy, like at Aga Khan Hospital University. If you want to learn laparoscopy, like, it's with this man. So I was like, you know what? It makes sense that I go with this man. because he can see, he's a gynecologist, and he can ask the questions and immediately get work. So he went there, heard my long, sad story, and I remember that here in Nairobi, everything is super fast. Like, you go today and you had your surgery tomorrow, or if you have a pain today, you have the consultation that same day, and then whatever you need, the treatment starts tomorrow. It's so fast. It's nothing like Germany. But for this particular guy, I had to wait for 3 weeks, which told me what I needed to know. I was like, okay, this guy, maybe he's very successful here. A lot of people come and see him. Like, if there is a waiting list, there must be a reason. So when I talked to him, he said, you know what? It sounds like endometriosis, what you are saying. I see that this doctor in Germany, he wants, yes, he says that we have to do a laparoscopy, but we also have to do something like, I don't know, it's like Chrome something. It's like to check the tubes. And he said, I don't know why this doctor wants to check the tubes, but let's check it. And then he also said, like, I also see that there is a myoma here. And since we're going in already with the laparoscopy, we just remove the myoma. So we went, and again, everybody said that it was an easy procedure and blah, blah, blah. So the day of the procedure, I went in, and the anesthesiologist came to ask me questions, and that's when I realized that it was maybe going in was easy, but the things that they were going to do inside me, they were not that easy. He explained to me, he asked me, have you ever had anesthesia? And I was like, well, I had anesthesia when I got my colonoscopy, but my colonoscopy was he said I was unconscious, but he told me that I was able to breathe. And then the anesthesiologist here in Nairobi told me, yeah, that's called light anesthesia. You are able to breathe on your own, but we're going to put you in in deep anesthesia. You won't be able to breathe on your own. We're going to actually put tubes on. And then I had a dimension of what was going on. So I was like, oh wow. But by that time I was already in a robe. I was already like on the bed. We were like 2 hours away from the surgery. So I was like, I sort of panicked, but I was like, you know what? I mean, what can I do? What would I do now? Should I like run? And no. And I want the answers. So I'm just gonna go through. Especially because I have family history. I have family members who have, because of bad anesthesia, they have passed away. So I was scared, but my desire to have answers was bigger than my fear. You know what I mean? This is how desperate I was for answers, and to not have pain, to live a pain-free life. So I went there, and I woke up. Of course, I didn't remember anything. My throat was sore. I couldn't even talk much because of the tubes. And I remember when I woke up, I gasped for it. I was like, I can. And then I said, it hurts so much. And the post-op guy was like, yeah, we're gonna give you medicine, but we're happy that you woke up. And then that's it. But as soon as I woke up and they wheeled me to my room, to my medical bedroom, they gave me a USB. Can you believe that? They gave me a USB. And they said, like, there you go. This is your laparoscopy. We have it on video. And I was like, excuse me? And I mean, I'm still like, I'm shocked. That would have never happened in Germany. I'm so thankful that I didn't get my laparoscopy in Germany. I don't know, maybe this is a standard procedure. If you're a medical professional, please let me know. Maybe it's a standard procedure that you get a video from your laparoscopy, which I think it's an amazing and revolutionary thing, because that video has changed my life. I think everybody should have the opportunity to see your insides. It's a humbling, eye-opening, life-changing experience. And also, I think you understand the level of craft for this profession, for the medical profession. It's just, I can sit down here, and it's already 34 minutes. I'm sorry, but I can sit here and have another hour discussing all the feelings that I felt when I watched the video, but also like all the respect that I gained for medical profession, for doctors and for nurses and for anybody who's in the medical profession, and also all the respect I gained uh, for this bigger energy, for God to create us in such a perfect way, like our systems, like our bodies, how they function, and like it was a very humbling experience. That's all what I can tell you. So when I gather strength to watch that video, which looks like butchery, it was terrifying, but also it was like wow, because I was able to see my intestines, and I was able to see my uh, visceral fat, and I was able to see my uterus and my ovaries, and it was an eye-opening experience. So for the laparoscopy, you have like 3 incisions. You have 2 incisions here, so they can. It's very fine, stick-like instruments. So they put these sticks, and those are the instruments that they're using to do stuff in here. But in your belly button, actually near your belly button, they also go in with a camera, and that's the camera. So you have the perfect point of view, and they are moving around the camera to see like the uterus and everything, so the POV is from there. And I saw everything. So what was the moment, the striking moment of that video? As soon as he got in there, the first thing that he did, when now that the instruments were there and everything, he noticed a little hole, which maybe, I don't know, maybe doctors, gynecologists, they are trained to see that, but my untrained eye would have never noticed that there was something weird with that hole. I would have thought, I yeah, I would have thought that that was normal, that was part of that, because this is, let's say that this is my uterus, and the tubes are here and the ovaries are here, and this little hole was here, and so it was part of, not the uterus, because the uterus is here, but it was like part of the tissue lining, the lining inside the stomach. It looked like that. It didn't look like a weird tissue or anything. It just looked like a hole. I don't know, man. Anyway, so he started playing with that hole. He started like picking it up, and I think he was realizing that this was a tissue, which actually was an adhesion. And then he starts playing with the hole and making it bigger with the instruments, and eventually he takes it and burns it, and like cuts it and makes it bigger. And when he cuts it, it's like he did this, and when he finally got rid of this tissue and he opened it, surprise, there was a pool of old blood. And how do you know that it's old? Because it's chocolate like. It's like chocolate. And then he started digging in, and there was like massive white tissue, which I assume it's endometrial tissue. And the thing is that this tissue that it's supposed to be inside your uterus, the endometrium, that like every time in your menstrual cycle this tissue bleeds, this tissue falls and goes through your vagina. But because this tissue is not in my uterus, it's outside, every menstrual cycle it bleeds, and it reacts like to whatever my hormones are saying or doing. So I assumed this was bleeding, but it was trapped under that adhesion. Can you believe that? And that's this blood that it was, I don't know, contributing I don't know, man. I don't know, every month, like the sun. And the tissue under the blood, which was a lot, I saw him burning the tissue. That was the pain that I didn't know of for 10 years, which makes a lot of sense that in the ovulation I had like some pain in there because that tissue was reacting to hormones. And the pool that everybody was seeing but nobody knew what it was, well, surprise, bitch, that's the pool, I assume. I don't know, I'm gonna have a conversation with my gynecologist, the surgeon, on the 16th. But like now everything clicks, and I think this is why it was such a humbling experience. And that was the first of many things that they did to me. I don't know, wait, I think it's getting like too dark because of the sun. But anyway, many things that they did to me in that 1 hour and a half, 2 hours, I don't know how many hours I was in there. And well, in the report, because they gave me a report, the report said that I had endometriosis stage 1, but they, what's the word, cauterized, burned, they burned a lot of tissue. I don't want to imagine what endometriosis stage 4 looks like, because what I had, it was a lot already. And he went in deep in my right ovary. I think I even had like an endometrioma, which is like endometriosis in your ovaries, and they have to be very careful to remove it, otherwise they could like mess up the ovary. And he went in, and he was like very crafty what he was doing. And the last thing that he did was taking out the myoma. The other doctor told me that the myoma was not that big, baby. This is my uterus, and the myoma was the same size of the uterus. So every time that they had to move the uterus up and down because they needed to see if under the uterus there was tissue, which there was, and also pools of blood and everything, that gigantic head with the uterus was moving around. How can you tell me that it's normal and I continue living my life and it's not gonna do anything? That's basically second uterus, or that appendix that my uterus is having. It's stealing, I assume, energy, blood supply, and things that it's not supposed to be there. So I am so grateful that actually this gynecologist was like, we're just gonna take it out since we're in already. So I think, to wrap it up, to finalize, it took me four different medical systems to get to the procedure that gave me the answer in 10 years. Ecuador, Vietnam, Germany, and now Nairobi. And I'm very forever grateful to the gynecologist, Dr. Timona Obura, in Aga Khan University Hospital, that he believed in me. He believed in my pain. He believed in my despair. I'm not saying that the other professionals didn't believe in me, but I don't know. 10 years of, even I even had professionals telling me everything is in your head. I don't see anything, like, because I know that medicine is a form of art. I know that medicine, it's like it's not a linear thing. It's like, okay, we have to go through way A, and then B, and then C, and then D, and then E, and they have to try several times. And I know that the way that this medical system all over the world is designed for this 15 minutes conversation, that I don't think you can cover this in 15 minutes. So maybe it's not even, maybe these are overworked doctors that they are trying to do their best in 15 minutes. But I think, like, I don't know, the system should be rearranged in a way that patients will have more autonomy, and people not only believe us, but maybe there's like, I don't know, patient management. I don't know, man. I don't know, but this is my story. Thank you so much for bearing with me. And I think what I want to say is that fight for your right of a voice. You have a pain that you have normalized because all your all these doctors have told you that it's fine. I think you have to fight for your right. I think you have to go there, and you have to try to find someone. Fight for your body. Fight for your body, and find somebody, because somebody will hear. Somebody in this world with millions and billions of medical professionals, somebody will hear you, and somebody will take you to the right way that will find you an answer. So that's it. Thank you so much for being with me, and I wish you a lovely day.